If you run a medical practice, you already know the feeling. You spend Friday afternoons staring at a denial queue that keeps growing, trying to figure out why claims that should have been paid are sitting in limbo. This graph tracks a metric that keeps practice owners awake at night, the National Initial Claim Denial Rate, which reached 11.8% in 2024. When we zoom out to the industry level, that percentage translates to an estimated $262 billion that U.S. healthcare organizations collectively lost in a single year. For a practice generating $10 million a year, that macro loss scales down to nearly $480,000 in revenue walking out the door. National data shows that 65% of these denied claims are never reworked. Staff run out of time, the backlog grows, and 2/3 of that missing revenue is eventually written off. This is actual earned money permanently leaving the practice due to preventable coding inaccuracies at the very start of the process. The core problem is rarely a lack of awareness. It is the structural difficulty of staffing a dedicated clinical documentation integrity, or CDI, team in-house. This chart breaks down the financial burden of an internal hire. When you combine base salary with benefits, payroll taxes, and training, the fully loaded cost for a single in-house CDI position reaches $75,000 a year. Administrative penalties stack up alongside those payroll costs. Reworking a single commercial denial drains an average of $63.76 in staff time. There is also a clinical cost. Providers often resort to pajama time, catching up on documentation after clinical hours, which accelerates the burnout loop. When billing and coding staff inevitably turn over, the disruption creates an immediate spike in denial rates and a growing backlog of unfiled claims. The in-house staffing model creates a documentation bottleneck, trapping practices in a cycle of lost revenue and clinical exhaustion. High-performing practices are solving this by treating documentation as a strategic function and outsourcing it to dedicated teams who focus on nothing else. Credentialed professionals from AAPC and AHIMA provide the specific expertise required to accurately translate complex clinical care into correct reimbursement codes. This model replaces volatile overhead with a transparent, fixed-cost rate. For example, Staffingly provides dedicated specialists for $399 per week per seat, with no additional burden for benefits or payroll taxes. Because the provider assigns a dedicated team rather than a shared pool of staff, the same specialists show up every day. This consistency allows them to master a practice's specific workflow and payer mix, shielding the office from turnover-related disruptions. This operational shift transforms a variable administrative burden into a predictable fixed-cost asset. Implementation moves quickly. A specialized team can handle onboarding, protocol setup, and a full go-live within a 14-day window. These specialists work directly inside the practice's existing EMR system. This native integration eliminates the lag time and data transfer risks found in manual reporting. AI-augmented workflows then route incoming work based on payer type and complexity, ensuring the right specialist handles the right claim. Predictive workload management tools flag potential denial patterns before the claim is ever submitted to the payer. Human supervisors conduct daily random sample audits to catch and correct error patterns before they compound into denial trends. Technology handles the high-speed pattern recognition, while credentialed humans apply the nuanced clinical judgment that software cannot replace. While the national average for documentation errors sits at 11.8%, specialized outsourcing teams maintain an error rate below 1%. According to HFMA, active CDI programs produce a 30% reduction in denials, significantly increasing retained revenue. Management teams maintain total visibility through weekly KPI dashboards that track throughput, accuracy, and direct ROI. The model is designed for flexibility, allowing practices to scale their dedicated team up or down after an initial pilot without long-term contracts. Solving clinical documentation integrity is the upstream fix required to secure cash flow and stabilize the revenue cycle. By outsourcing